Run It Studios and the Arthritis Foundation of Missouri bring you this special episode of the Run Radio Podcast. Welcome back to the Run Radio Podcast in partnership with the Arthritis Foundation of Missouri. My name is Trina Wilcox, and on Run Radio, we like to talk about running things. And one of the things that many of us run in our lives is our health, our chronic conditions. Mine is rheumatoid arthritis. A lot of people have similar conditions. And today we're going to talk to our expert, Dr. Kimberly Carroll with the Arthritis Foundation's Walk. You are the medical honoree this year. So congratulations and welcome.
Thank you. Thank you. Thanks for having me.
Absolutely. So tell me how you got involved in this side of medicine. What made you interested in rheumatology?
That is a great question. Full disclosure, no one else in my family is in medicine, and I wanted to be a doctor ever since I was a little girl. But I honestly, once I got to med school, I had well, now what kind of moment. And I initially started down a little bit of a different track. I was very interested in neurology, and I started residency, in that. And then actually, I had a very personal event. My dad got diagnosed with a severe autoimmune condition when I was in my first year of residency, so my intern year. And he had one of those one in a million rare things. And I had a personal pull, I guess you could say, to get more interested, on that front in the field of rheumatology, and also just intellectually, to be honest, it's a really fascinating field. And so I switched gears, and then I never looked back. And it was one of the best decisions I ever made.
Oh, good. Well, we're glad to have you helping so many people. I guess the next question would be, what drew you to this neck of the woods? You're from Wisconsin? Is that where you grew up?
Yes, yes. I'm from the great state of Wisconsin, proud Wisconsinite, but I've been having a great time in Missouri now for close to 10 years.
Ah, good.
I will admit, as amazing as Wisconsin is, the winters were getting me a little bit. Yeah, the winters, I'm maybe a little bit more wimpy than some of my family and friends. So winters were getting colder and colder, it seemed, year by year. But if I'm perfectly honest, the main reason was my boyfriend had a chance to train for his emergency medicine residency at WashU. And I was finishing up my rheumatology fellowship up in Wisconsin, and we still liked each other. And so I said, all right, well, I'll look for a job down in St. Louis. And we really thought it was just going to be a few years, but I really, really like it here in Missouri.
Oh,
So,
good.
yeah.
Well, if you think our colds are milder, then bless you
Yes.
because
Yes. Yes. Maybe not the last bit of January into February. That hit a little too close to home, literally. But overall, yes, it's less bitter of a winter down here.
good to know because I was starting to really get angry with Mother Nature myself.
Yes. Yes.
So
Likewise.
you probably see a lot of patients that do get impacted by the weather and things like that. So what's that kind of like?
It's not an old wives' tale, so to
Yeah.
speak. It is a definite thing. And most people, I would say, tend to just do worse during the winter, during the like damp, cold. A lot of patients will have issues with their joints in particular. They can tell when it's going to rain in a day or so, or they can tell when a low pressure system is going to come through. And so that's a definite challenge for a lot of our patients is getting through the winter. Some folks are, kind of lucky enough to be able to find time to, go to Sedona or Phoenix for a few weeks or Florida, but a lot of folks bear it, through the winter. And sometimes just awareness that that's a thing and that's a legitimate thing is helpful for people to, I think, for a lot of patients to get through it and know that they're not, it's not all in their head.
What is
This
the scientific reason for that? Because we do often hear it as a wives' tale, and people are kind of like, yeah, but really there is science behind it.
Right, right. And, full disclosure, um, I don't have my PhD in physics or meteorologic science, but in general, pressure systems act on fluid and gas in the atmosphere. Um, we are human beings with fluid and gas in our body, in our joints, and so there's some theories around that being a big factor, that there's expansion of certain tissues and contraction, and whether or not that's stretching on certain pain fibers. It we see it too with even migraines. People who are prone to migraines, that impacts them quite a bit. And some people are more sensitive, it seems, than others with it. But um, that's my understanding of the current understanding of it.
I know you treat patients with RA, gout, lupus, and some of the other disorders. Can you kind of touch on those a little bit? For some of us that are affected by one, we might not fully know what someone else is dealing with, and it just kind of can help with us being more understanding and compassionate.
Oh, sure. Yeah. So, rheumatology is kind of an interesting field. I'm certainly biased, but we do, in some ways, it can seem like we treat like a mixed bag of disorders. A lot of things that we deal with joints and arthritis. And so, um, we have certain types of arthritis that are related to autoimmune diseases, an autoimmune etiology or an autoimmune reason. So that can include the rheumatoid arthritis, psoriatic arthritis, even lupus, can cause a type of arthritis. And then we have management of some other conditions that aren't really, considered autoimmune disorders, but they impact the joints. And so that would be gout, for example, is a type of inflammatory arthritis
Mm.
that we treat. So there's to walk back a little bit, just speaking purely from arthritis, there's a lot of different types of arthritis. Back in the day, it used to be, kind of lumped into rheumatism,
Yeah.
and that was kind of a catch-all. But as has gone by, there's been some differentiation of different types, and in general, this is a real gross generalization here, but in general, I like to think of it as inflammatory causes of arthritis
Mm-hmm.
and non-inflammatory causes. So
Mm-hmm.
if we think of a house built a couple decades ago, sometimes that house can wear down over time. That's kind of the osteoarthritis
I knew
that
exactly.
we think of. And even there's some hot debate about whether or not that also has an inflammatory component to it.
Okay.
But that contrasts a bit to when we think of like inflammatory causes like rheumatoid arthritis, autoimmune driven inflammatory arthritis like rheumatoid arthritis, psoriatic arthritis versus gout, which is an inflammatory arthritis caused by a crystal deposition of gout crystals. Um, and then too, with some of our other patients, they don't, thankfully they don't struggle with arthritis, but they may have autoimmune conditions that inflame their blood vessels.
Mm.
So they can have what's called a vasculitis, and that can wreak havoc on, almost any part of the body, you name it. And lupus is another disorder that you can have autoimmune driven inflammatory havoc on your kidneys, on your heart, on your skin. It can manifest a lot of different ways. And so um, it is kind of a mixed bag of disorders, but for some of our diseases, there's a lot of overlap in the medications that we can use to treat them. So some patients may talk to a friend, let's say we have a patient with rheumatoid arthritis and they're on a certain medication regimen. It may be very similar to what one of our patients who struggles with lupus
Mm.
takes. And so thank goodness there's at least some overlap with,
For sure.
the medications that we use.
Is there something similar with all of those that people can watch for as a sign to get to the doctor? Or are they all, I'm sure they're all a little bit different. They manifest different in different patients, but what are some of the things that are markers? Hey, this needs to be seen?
Go in and see. Great question. So, a lot of times with the arthritic type disorders, it's red, hot, puffy, swollen joints, and stiffness.
Hmm.
Just set in cement kind of stiffness,
Yeah,
particularly in the morning. That is a big kind of key to, go seek some medical attention. But honestly, then we have other disorders like lupus or some of our vasculitic diseases where it can manifest a lot of different ways. And so it's just kind of in general, if there's like rashes that are totally unexplained and very sun sensitive or what we call photosensitive, if there's fevers that are totally unexplained, ongoing, weight loss, usually things that are really out of the ordinary for someone, that I say it's never a bad idea to bring it up if something's very out of a patient's ordinary pattern. But with regards to the arthritic conditions, a lot of times it's swelling, stiffness, worse in the morning. And this one's a hard one, fatigue.
yes,
Uh,
yes,
fatigue.
right,
That's that's difficult because that can be, related to a million different
sure.
things. But that is something that a lot of our patients, they'll say, I was running 5Ks and doing all the things, and it's above and beyond what you would expect for any of your peer group,
Right.
just like you feel unplugged type
Yeah.
of.
Okay, good stuff. I know you said a lot of times the medications can overlap for the different types of diseases, but what about comorbidities? How many of these diseases usually will see either another chronic condition or even one in this same kind of rheumatic group?
Right. So, unfortunately, quite frequently. And let's just say if I have a patient with already with rheumatoid arthritis, if they're starting to have other issues like they're having color changes in their fingers or Raynaud's, and maybe their kidney function tests aren't really acting the way we want, I have a lower suspicion in that patient that they could have an overlap condition with something like lupus. Sometimes these things can ride in the same car together, unfortunately.
Yeah.
So when I already have a patient plugged into me, really anything that they tell me that's new, I kind of see it through a lens of could this be another autoimmune phenomenon popping up? Because we do see that pretty frequently. We also, though, unfortunately, we see fairly frequently things tag along like fibromyalgia or a lot of chronic fatigue issues can piggyback along with some of our disorders as well. And those aren't, necessarily autoimmune conditions, but we see those overlap quite a lot.
I know a lot of times the number one piece of advice is listen to your body, but as a lot of patients know and experience, it's sometimes hard to do that because you get used to pushing your baseline to a certain level, and then if something new swoops in, you don't know if you're really that tired. Do you have any kind of fresh take on that that we might be able to get better results from?
Oh, yeah. So I agree. I think the adage "listen to your body" is great advice. Especially with some of my patients who they've been struggling with rheumatoid arthritis for 20 years. If they tell me, "Hey, this type of joint pain feels just like the type of joint pain before I got diagnosed and on treatment," I take that seriously. I think, well, they're flaring probably.
Mhm.
But you're exactly correct. A lot of people, it can be really hard to really pin down what exactly may be ailing them. And so it can be helpful to keep a journal. It can also be really helpful to, if you have someone close in your life who, kind of knows your patterns pretty well, knows you really well, and, can kind of keep tabs on how you are able to complete your daily living tasks,
Yeah.
getting their take can be beneficial. So sometimes I have patients who they'll bring their loved one in, and their loved one will say, she's not herself.
Yeah.
She used to be able to go up and down the stairs 10 times a day, and she still goes up and down the stairs 10 times a day, but it's slower and she's kind of groaning with it.
Yeah.
Things like that. That's useful information. But it is just really, really difficult, to sort out sometimes RA, for example, RA symptoms from other types of medical issues that people are dealing with.
That's a good tip. Thank you. So this brings us to your involvement with the Arthritis Foundation of Missouri. How did you get plugged in? What's it been like?
Yeah, so so since I moved down to Missouri, I've been to the Silver Ball that I
Hmm.
think they used to call it the Silver Ball on occasion, and I'm pretty active with the Lupus Foundation as well. And Leah Levin, who's
Yeah.
been a friend honestly for a couple of years. I mean, colleague, but really a friend.
Yeah.
She's now with the Arthritis Foundation, and so she's looping me in stronger with the Arthritis Foundation, and I'm really excited about that.
Good.
So because the bulk of the patients that I see in clinic every day are rheumatoid arthritis and psoriatic arthritis patients. That makes up the bulk of who we take care of.
Do you see young patients, youth?
I do. I do. And I'm getting a little bit older, and so some of my patients, I have no idea what lingo is current.
Yeah.
But I do see. I'm really an adult physician, but on occasion I've seen a 17-year-old or
Mhm.
16-year-old with the family that has concerns for maybe some rheumatoid arthritis brewing or like even celiac,
Yeah.
gluten intolerance related arthritis. I've
Yeah.
seen that in a couple of young folks. Some of our patients with lupus, they tend to be younger African American and Hispanic women, and so we see patients in their 20s. You know, unfortunately, frequently enough.
Yeah. Yeah, for sure. So you're going to be honored at the walk this year. And have you been to one of the walks before? Is this your first one?
This will be my first one. This will be
Cool.
my first one. So I'm really just humbled. I'm really excited about it.
Good. And we hope to see you at the Bone Bash too, if your
Yes.
schedule will allow.
Yes.
Um,
Yes.
what are some of the other things that have just been, rewarding, let you know that you remind you that you chose the right, that tug, you answered the call to move into this space?
I think a couple of things. Let's see. I mean, one of the coolest parts of my job, it may be more in the cool category as opposed to rewarding, but I see people from every single walk of life you could imagine, and I just learn the coolest random stuff from people,
That's
and
neat.
that's fascinating. I have patients who are plumbers, I have patients who are artists, and just hearing a snippet of what they do, it's just really kind of cool to me. And just getting random curbside basic plumbing advice is never a bad thing. But so that's really, really, honestly, that's a ton of fun for me. And kind of fortunately, unfortunately, we deal with a lot of chronic disease, and so we see our patients chronically.
Yeah.
And I mean, it gets to the point where I know if they have a grandkid on the way, I know if their son's getting married, and that's also really cool, to just be a part of people's lives like that, be someone who patients feel like they can count on, and you're a trusted person to take care of them. um, but then I think for the rewarding part too is it is really cool when someone gets treatment and they get their life back.
Mm-hmm.
And they are like, you walk in the room, maybe you meet them day one, and you can just see, their face is kind of drawn down. And, I'll be honest, sometimes it's just that's the right medication for the right
Yeah.
person. And we got lucky with picking the right one that worked at the right time. But when you see a certain medication, working for a patient, they're tolerating it well, they're able to run again, they're able to pick up their grandkids. That is that is a ton of fun. That's super rewarding to see. Uh, because people lead busy lives and they don't,
Yeah.
they don't have they don't have time to hurt.
Yeah,
And so
exactly.
that's probably the coolest part is, um, being able to, figure something out, write a prescription, and it work really well for someone, and they're really just back to doing what they want to do.
That reminds me of a story when I was diagnosed as a 6-year-old, we didn't have pediatric rheumatologists in the area. So it was, what are we going to do? Thankfully, we had an adult rheumatologist say, I'll see here. I'll take
Right.
care of her, And so my doctor, Dr. Hayes, who saw me as a youth and I grew up and I ran my first marathon and I took my medal to show him. Well,
Yeah.
now he has since retired and now this is aging me, but I see his son as my
Oh,
rheumatologist. He
that's so
still
cool.
talks about that story. He's like, my dad
Oh,
tells me the story.
oh, that's so cool.
And
That is
that's
so
just one of
cool.
those things you should know you are important to us. You help us live our lives in a way we are at risk of not having at all.
Right. Right.
So thank you for
That
that.
is super cool. That
Yeah.
is super cool.
Yes. So I hope you
Um,
get to have many of those experiences. I look forward to hopefully meeting you in person at the Bone Bash this year. Thank you for all you're doing for the Arthritis Foundation because this is such a valuable resource for so many people.
oh, well, it's my honor. It's my pleasure. I appreciate that.
Thank you so much. Hope you'll learn more. You can find out about the Missouri chapter, a chapter near you, and even more resources and ways you can get plugged in at arthritis.org. You can watch the videos on any platform you prefer when you link over from runitstudios.com. Thank you.
Well, thank you.